pediatricians here.
I'm here just to ask you a few questions about what makes hospitals scary for kids.
Okay.
So, can you tell me like a cool fact about your job?
I think one of the coolest things about being a pediatrician is that I get to see kids from 0 days old, right when they're born, all the way up to age 21. So a lot of people get to see a much smaller segment of the population, but I get to see from the littlest kids to big kids who are really more like adults. So I think that's pretty cool.
Can you tell me about a time you worked with a child and the child was just like really scared?
I work with kids who are afraid a lot. Mostly that is surrounding needles. So kids are afraid of all different types of needles because, to be truthful, they hurt. So I'm scared of needles sometimes too, but not as much as a kid is. As an adult, I know that the needle might hurt me, but that I know that I'll be okay and it'll be all right. But some kids are really, really afraid of anything that might hurt them. So whether it's a needle like a shot that you might get in your arm or your leg, or a needle like in a hospital that's an IV that puts things into your veins, like into your blood, so fluids or medicines. And so those are two types of needles that hurt kids, and so some of them know that it's going to hurt, so they're anticipating how much it's going to hurt, and it makes them really afraid.
How does it make you feel when you see a kid just crying because he's frightened?
Well, it makes me sad because being a pediatrician, I want to take good care of kids and I want to make them feel happy and better. And it's hard that some of the things that I have to do to take good care of kids have to hurt them before it makes them better. So these needles, these things that hurt, are ultimately going to benefit them, but they don't know that. They're too young. They don't really understand that. So it makes me sad that what I have to do to make them better might have to hurt them a little bit in the beginning.
Does it make it hard for like the staff if the child's like acting up or like just crying?
Yes. Unfortunately, kids don't understand because, again, they're too little. The little ones, older kids might understand a little bit better, but little kids, it's hard for them to understand that the more they fight and yell and scream and get upset, the more the stuff that we're going to do is actually going to hurt them. So the more you fight getting an IV put in your arm, the harder it is for the nurse to do his or her job, and that's going to make it hurt for them more. And then they might have to try more times. So that's a hard thing for kids to understand, and it does make it harder because the more times we have to try, the more the kid is going to hurt. And so, yes, it does make it more difficult for us to do what we need to do if kids can't cooperate with the very important things we have to do for their health.
So what do the hospitals do to help the hospital not be so scary?
So a lot of things. You see that we're in a playroom right here. It's sort of like their playroom at home. And so this is here in the hospital on the pediatrics floor that makes kids feel a little bit more at home. Like, oh, there's a playroom here, I can play. Everything that happens here isn't scary or bad or sad. Also, we do a lot of distraction. We have special people that we hire called child life specialists whose job it is to help kids be less scared in the hospital. They talk to them during different procedures or tests or shots or needles to make them be calmer and maybe not focus on the thing that might hurt them so much. And we have toys and things around that they can have in their room during the scary stuff so that they can focus on fun things or pretty things rather than focusing on the stuff that hurts.
So what would it mean if kids at a hospital were more comfortable?
It would mean really good things for the kids and for the doctors and everyone working there. It would make everybody's jobs easier, and it would make the kids healthier faster if they were able to cooperate with the things that we needed to do with them. Aside from that, it just makes the experience better. You have a better experience if kids aren't scared. Families and parents feel better about the care that their child is receiving if their child is happy with it and isn't so scared. It's really stressful for families and parents to see kids who are really scared and sad and upset. So it makes a better overall experience, and the child might actually get better faster if they feel better about it, happier, not so stressed or sad. So it makes a really difficult experience less difficult if children would be less scared. And medically could actually make them get better faster and be able to have a better experience during their stay.
So can you just describe yourself for me?
Sure. I think I'm a fun woman who likes to take good care of kids. I like to play with them, and that's one of the reasons that I got into pediatrics in the first place, that I really like to hang out with kids. I feel like I'm a big kid inside sometimes too, so I can relate to them pretty well. And I've been doing this for about 5 years, 6 years on my own, maybe 8 or 9 years with some, people training me before that. And I live here in the city of Philadelphia. I think it's fun to live in the city. I like to go out to eat, go to fun restaurants and see the city. I like to travel and read and swim, getting excited for the warm weather. So doctors are just regular people, just like kids are. We have the same things that we like to do, things that we're scared of. So yeah, I think I'm a regular person, just like my patients.
So why did you choose your career?
Well, my aunt was a nurse, and so she was a nurse for children, and so I was exposed to pediatrics through her job. Sometimes when she would go to work, she would take me, and I would see some of the kids that she worked with, and that made me really interested in medicine for kids. And then as I got older, I decided that I wanted to be a doctor, and that I wanted to work with kids because no kid asked to be there. Their parents wanted them here, and sometimes kids live lives that are harder than they need to be. And so I thought that it would be a good job for me to help make kids' lives easier and happier, healthier and safer, and that would be the best way I could use my talents in medicine.
Thank you for taking your time out of your day to answer some of my questions.
Well, thank you so much for having me here. I like knowing what kids might want to know about my job and about hospitals and offices and what they might be like. So it's always a pleasure to get to interact with people and patients in ways that we wouldn't usually on a regular basis. It was fun to meet you, and maybe you'll be a doctor.
Thank you so much.
Thank you. To everybody at Northfield, I want to thank you guys for what you're doing to make hospitals less scary and more comfortable for kids. I can't wait to see what you come up with. Bye.
Bye.